the science. So our first speaker is Dr. Ashley Young. Ashley is a haematologist based at the Peter Mac and the Royal Melbourne Hospital. He has expertise in treating patients with acute leukemia and other diseases affecting the blood system. He's also a researcher at the Walter and Eliza Hall Institute for Medical Research, and he's looking into how blood cells are produced from stem cells and what goes wrong in blood disease. So Ashley, over to you.
Thank you so much, Megan, and lovely to see so many faces on a Melbourne evening. So that's a nice euphemistic way of placing it. Yes, I'm Dr. Ashley Young. I'm a haematologist, as Megan told you. I work at my research from the Walter and Eliza Hall Institute of Medical Research, but I also work as a clinical haematologist, mainly treating patients with acute leukemia at the Royal Melbourne Hospital and Peter MacCallum Cancer Centre. So all fairly close by within the precinct. Oops. I think I broke it. Didn't take me long. So what do I do? So I'm a clinician researcher, and that means I research in terms of trying to understand the diseases that I treat, but also I treat patients as well. And my research is really focused on looking at factors which help regulate blood cell development and stem cell development, and create, to make a stem cell, which is a very basic blood stem cell, into the cells in your body. So blood stem cells were one of the first stem cells ever characterised in history. They were known to have specific properties in terms of being able to recreate the entire blood system of an organism in humans. They're responsible for making eventually the red cells, which carry oxygen in the blood, the white cells, which fight infection, and platelets to actually stop people bleeding. And these are the fundamental blood products which actually keep us healthy. But the way that blood stem cells do that is actually fairly complicated, and how we actually understand a blood stem cell becoming those cells is one of my areas of research. I'm also very interested in how abnormalities in the genes that control these processes can also lead to blood cancers. So stem cells have been actually used by us as haematologists for decades. And the reason that we're able to give patients chemotherapy for treating, for example, their leukemia, is the ability of these stem cells to resist death from giving our chemotherapy agents. When we give our treatments to our patients, we have them in hospital for a good period of time because the chemotherapy agents cause a fall in the numbers of the white cells, the red cells, and the platelets that I told you about before. These resistant cells are able to repopulate the entire patient's blood system, but happens over a period of weeks. So these unique properties of stem cells we actually use in terms of our treatment every day. We've also been able to use our stem cell treatments as living therapy. So for some patients with certain diseases, we give such high doses of treatment with chemotherapy and or radiotherapy that without giving the patient's own stem cells back to them, they would have significant complications of bleeding and infection. And so that's what we call autologous stem cell transplantation. And the contribution that we've made in Australia was from this gentleman named Don Metcalf, who identified factors which actually could stimulate the stem cells being released from the bone marrow and into the blood. And the way that that's what he used, something called GCSF, or granulocyte colony stimulating factor, to give to stem cell donors. So, for example, in the left-hand side, you can see our traditional way of sucking out the bone marrow from patients to actually access the stem cells. We have now, predominantly in adults, used that machine to actually able to collect the stem cells from patients after administering the GCSF therapy. So that's been a fundamental scientific breakthrough led by Don Metcalf, which has actually changed the way we've collected stem cells across the world, with over hundreds of thousands of donors being collected this way now. One of the important things, however, is to actually think about using stem cells from someone else. So for certain diseases such as acute leukemia, we actually know that giving them chemotherapy, the chemotherapy unfortunately fails them. And when we've given autologous stem cells and higher dose chemotherapy, that doesn't really impact on how their survival and how we can cure them. What has been found out is that if we can sometimes give the stem cells from someone else to the patient, we can actually cure them of leukemia, including leukemia which has been resistant to treatment from chemotherapy. And the reason for this is that ability of those stem cells from someone else to reconstitute the immune system. But it's not the immune system of the patient, but it's the immune system of the donor. And that donor immune system, which recognises the leukemia as foreign, is able to actually destroy those the leukemia cells and recognises them not natural to it, and that was what results in the cure. So those are important things, because one of the two things when we're talking about from the next couple of things is that using those technologies over the last few decades, we've been able to now to use, for example, autologous stem cells, that means the patient's own stem cells, if they had a defect, and correct some of those with gene therapy. So for patients with certain blood mutations, such as thalassemia or sickle cell anemia, where there's a mutation in the red cell gene which causes the red cells to behave abnormality, if that abnormality can be corrected or mitigated by correcting the genes in the patient's own stem cells and then giving those stem cells back to the patient, we can actually reduce the severity of that disease. And certainly that's been shown in the last few years that can be an effective therapy for diseases which would otherwise not be curable. Similarly, if we can actually use the immune cells rather than the stem cells by manipulating the genetics of the immune cells to use those cells to attack the leukemias, that means we can use these as living therapies against leukemia. So for some of these therapies you may have heard of are called CAR T cells, and those mean chimeric antigen receptor T cells, which are like directly targeted T cells from a patient to the leukemia of the patient. So what I'm talking about here is looking at the last few decades where we've used our understanding of stem cells and married that with our ability to understand the genetics of diseases, but also manipulate those genes in the stem cells to actually be able to help cure patients of other diseases, but also to use that same technology that we've learnt about to manipulate other cells of the blood system to use to treat leukemias which has otherwise been unable to be cured with chemotherapy or bone marrow transplant. So I'll leave it there, and thank you.